Hi, everyone. Thanks for showing up. This is really informal. I'm Dr. Sienna. Please feel comfortable speaking up, raising your hand, asking questions when you have. This is a very dynamic type session for me, primarily because it's a very new topic. So a little bit of a background on me. I'm an emergency medicine board certified and trained physician in the allopathic world for 15 plus years. That's that side of the world. My passion and my rabbit holes, and there's many of them and they keep growing, is pretty much everything else that's out there. And it really does stem from genomics to peptides to functional medicine to photobiomodulation, all the wonderful devices that you guys have, if you have partaken in the devices, this biohack lab. And on one of those rabbit hole journeys, I came across biologics and the various forms of stem cells, and there's many different kinds in that class. And I got very fortunate, or let's just say something came across my path while I was looking and I paid attention on VSELs. And I think I got introduced almost 3 years ago now, and it was still very, very, very new. And a lot of controversy even then, and there's still controversy now, but it was even in the stem cell world, if you can call it, it still wasn't respected. It still was considered kind of woo-woo in the sense like, are they really there? Is there a lot of them? And there's a lot of controversy. Still some, but even then there was more. So because of that, there isn't as much research and data, and if you were to look up PubMed or look at those kinds of things, you're not going to see as many, and that can make some people uncomfortable. But with moving times, with cutting edge stuff, it takes time to do those things, and so that's one reason why I'm here, is to help answer any of those questions with what we know at this point in time. Yeah, so does anyone, I imagine you do if you're here, but does anyone know what VSELs are? Some, a couple, very little. Okay. It's an acronym. It stands for very small embryonic-like stem cells. Okay. And to break that down, the very small part is stem cells are it's why we're alive, right? It's literally is what we're created from birth. And when we no longer have stem cells, it is pretty much the definition of death. Human death. We can't turn over our cells. And our bodily tissue, every single cell is turning over and has its own lifespan. We have a completely new body. I don't know, you can ask everybody if it's 7 years, 11 years, whatever, but depending on our nervous system, but our entire body's turning over. And the only example of turning over, the only way it can do that is if we have stem cells going to those areas to repopulate, to give the signal to those cells that, okay, we're turning over, we're making new ones, and we're continuing this human existence. So very small is where are they, or basically how many nanometers are there, and therefore how far can they travel in the body to do their job once they've kind of gotten the signal and are being determined. That'll come into importance when we're trying to get past the blood-brain barrier and past our lungs. I'll bring that up in a second. The embryonic-like part is the coolest part for me, is there are totipotent stem cells, which means they're the fetus. They can turn into literally anything, including a fetus. Everyone gets concerned because those are the ones that can turn into tumors, because they can turn into anything. We don't use those except for scientific research and knockout stuff and that kind of thing. Pluripotent's the next level down, going, okay, we're almost can do everything, but not quite. So they're not going to turn into cancer type cells. They're not going to, at least in their own, they're not going to recreate a little foreign little embryo in your body. That's where we get excited, because these guys can turn into anything that we need it to turn into. Then there's more directed stem cells, and this is when you're getting them from your bone marrow, your mesenchymal stem cells, you're getting from your bone marrow, your fat. They can turn into most things, but they've already kind of gotten that little signature that we're only going to really be turning into certain types of tissues. If you are just being born, or just after being born, so from your umbilical cord, your amniotic fluid, just after you're born your baby. That's what we call embryonic-like. They're young, they're virulent, there's lots of them. And that's what we get. So that's before this happened, that's what most people were thinking were the gold standard. If you're going to get stem cells to treat anything, you wanted them to be young, a lot of them, and virulent. Well, you have your own at any age of life. So these guys are, we believe they stopped growing about 1 day to a few months after birth. And they live dormant, sleeping, attached to a protein for the rest of your life. So regardless of how old you are in this room or watching, you have stem cells as that would act like you were just born. The question then was, how many are there? And how do we turn these babies on? How do we get them to do what we want them to do? And that was the controversy before, until we realized that they were attached to this protein. So once we were able to uncouple them, we realized that they're in the millions, lots of them. And under certain stimuli, they will become active, meaning they go to that site of injury and do their job, which is to repair and to rejuvenate. If you have an acute heart attack, if you have an acute stroke, those strong stressors will do it. Extreme colds, probably more than the cryo over here, the cold plunge, but extreme colds can do it. Another one is the technology that I fortunately came across learning about, and we'll get to that in just a second. So imagine now that you are uncoupling these very young stem cells that you have in your body, so you don't have to get them from anywhere else. And they're so small that if you were to infuse them back into your body, they won't get caught up in the lungs. They'll keep circling around, and they're small enough to get past the blood-brain barrier into your brain, which is the first time we've ever had the capacity to have a regenerative biological product get into these tissues, besides actually taking a needle and injecting them into your spinal cord or your brain. Does that make somewhat sense of what Vsels are? And another beautiful thing about them is in your blood. You don't have a surgery. You literally do a blood draw. That's as invasive as it gets. One blood draw and then some tubes. We spin them down like PRP. I'll tell you how we turn these babies on. I like to say that because they are babies and they act like babies, which means we need to nurture them. And then we reinfuse them back into your arm. The question then is, well, stem cells do what they do. They go to sites of repair. So if you just stubbed your toe that morning and we take these and we want them to go your heart, your brain, to vital organs, they're going to say, no, I got a toe to deal with. I'll tell you how we redirect them. We literally can tell them within time period, no, come over here, override their body's natural signal, and they go to that area and they repair. So far, so clear? All right. If I'm jumping around, please let me know. I get excited about this topic. So now what's the magic sauce in all this? So Dr. Todd Ovokaitys, brilliant man. He's out of California right now. And I say brilliant because he wears many wizardry hats. He is a MD physician, initially in training, but also very done in physics, and he's created lasers many years and has known genomics for many years. Also writes symphonies pretty much, and lots of amazing things. Him and some other specialists in his field created, after many prototypes and a lot of experimentation, a specific frequency. We call it a song laser. Laser just keeps it simple because our minds can kind of get around the concept of a laser. Besides scalar refractory frequency projections is a little bit more difficult to understand. However, it is still a frequency. And if one adopts the concept that everything is frequency and every interaction is based on how one is connected to the other based on a frequency, then if we know what that recipe is, if we know what that frequency is, we can actually uncouple it. And that's what this song laser does, right? So we take those babies that we had just gotten from your blood, and we activate it by shining that laser on your blood product over a few minutes. And while it does that, not only does it uncouple the protein, so now you have PRP, which has all the beautiful components of PRP itself with the platelets and the growth factors and all those fun things. It's got some exosomes floating around in there. I'll throw out some terms for you. And now these stem cells. And when it does that, we have found that those stem cells remember what that frequency, what that light was. They were pretty much imprinted. And so when we infuse this back into your blood, we take that same device, that same laser, we point it onto the part of the body that we want those blood cells to go, and they go there. And they create some local, what they call cell-cell adhesion, which is how stem cells work. And basically, I'm coming to this area, I'm putting down property, I'm setting up shop, I'm telling you guys what to do. That's that cell-cell adhesion. And so that is a initial signal, and then the response grows over time. And we've got about 20, 30 minutes before the stem cells have kind of circulated so much that we've lost a capacity. The little cats have gotten out of the cage or whatever. And we've shown that this laser does that. It's real beautiful. And I wish I had an example of this one. It is on video somewhere. But if you know about scientists in petri dishes and how they find stuff, they tag stuff, right? That's how you know if what you were doing is actually going to where you want it to go. So they took activated stem cells, they put it on a petri dish, the agar here, they wiped it all across, okay? They took the laser, they shone it across the petri dish, and they left. They came back, and they tagged them, and they go, where are the tagged cells? And they're in perfect alignment just where the laser was. They literally had walked across the agar to where that was. And we've also shown clinically that where we have directed these cells, and they've done some other stuff, but that is a very strong visual that they go where we tell them to go, which now means we can direct them to the brain for people with Parkinson's, after strokes. We can't make claims, but we have seen with some clinical examples that for areas that we weren't able to reach before, we're affecting. Heart failure is my favorite. I've got a couple cases. But I also have some colleagues that have some cases. So if you would like to watch a couple, we can give a few case examples to kind of put what I described into reality. All right.
Here's another one. This is an MS case. This one I have on some video, so I'll show it to you. So this guy was police chief in Tijuana. And he did a really good job with the drug guys, and so they gave him a promotion and they moved him to Juarez. And the gang found him and he was shot 5 times in the chest, left for dead. And he had a T5 and below, no motor, no sensory. And his first treatment was about 7 months after that injury. After 10 days, a persistent, non-healing sacral ulcer, 3 months duration, completely healed in 10 days of treatment. At 6 weeks, he noted a return of partial erectile function. Over 6 weeks, spinal T5 sensory level improved 15 centimeters down the front of his chest and back. During the second treatment, 6 weeks after the first, he felt sensation in his abdomen and legs, felt needle enter his right foot. 2 weeks later, he began to wiggle his toes with plantar stimulation. Go ahead.
So we're here with Julian Dezaola. We did a laser-guided stem cell treatment in early December, and now it is January 21st of the following year, 2016. And the treatment was for an upper thoracic spinal injury, roughly the T5 level, and that's a very encouraging signs. So would you like to say what you have observed?
Lo que siento, or in English?
In English, if you
Okay. What I feel?
Yes.
Okay. Starting from my head to down. Oh, first in the lesion area around my body, I feel hypersensibility.
Yes.
too high.
Yes.
It's maybe it's dolorosa, painful sometimes. In my back, I have electrical shocks. I feel.
Yes. And this was this was below the level of injury, so it's the sensation coming back.
Yes.
Where you didn't have sensation before.
Yes, in my back and in my abdomen.
Yes. Excellent.
In my, ¿cómo se dice? Pompas, encadenas, buttocks. I feel burning, and I feel sleep.
Yes.
And in my legs, I feel electrical shocks all in all my legs.
Excellent.
All around, and my feet, and my heels, I feel burning and electrical shock. And then my pennies, I feel electrical shocks.
Yes.
And one says sensations to keep up
To get
in 2 times in the morning. I have one erection,
Excellent.
too high.
Too high, too much.
2 times.
So we're here with Julian.
I'm gonna skip the next one. So we had another treatment after 6 weeks. My sister. Then about 11 months after the 3rd shot or IV treatment, here he is. Go ahead and play that video. He's walking and he can ride a bike. This is a fixed.
He was
T5
paralyzed.
And below, complete lesion. Okay. Now, here's a gal, 16 years, macular degeneration, getting Avastin injections every 3 months in her eye. This is 45 minutes after her first treatment. Go ahead and play this one.
I have macular degeneration, and I really see almost nothing centrally from my left eye. With my right eye, I was able to see, if you envision a clock, I could see from 9 to 12 on that clock, but only with layers of screen in between. So it was foggy-ish, cloudy-ish, but I could still tell somebody had an eye, for example, whereas otherwise I couldn't see any features on their face whatsoever. And when I did the chart, the only thing I could make out were the top 2 bars on the large E. And now, I not only see the E, but I can tell the letters below it, the F. And I also saw a T below that and another letter with that line and the L and the letter below the line before that.
From the top line only, basically to 4 lines down the chart.
And that's within
post procedure.
Is that about 45 minutes afterwards?
So I'm really,
And what about your peripheral vision?
oh, my peripheral vision, because not only can I see them, but they're clearer. I don't have the screens in between that were making it foggy and cloudy, and I can see. I mean, if I look on the second line where there's the F and the P, if I look equidistant to the right of the P, that F and P are just like crystal clear.
Amazing. Yeah.
So I don't know. I mean, I do know.
Awesome. Thanks for sharing that.
I'm really happy for it. I have macular degeneration.
One
This
more.
guy was a
Or 2 more.
high-level athletic trainer in Thailand, spinal injury on a motorcycle. 17 years before, chronic severe low back pain. And here's his.
We're here with Stefan, day 3 post-procedure. He's looking, looking very bold and good today. So you'd like to tell us what you've noticed since you had the procedure a few days ago?
After the last one. So the first is that we made it last week started really soon when you put the plasma back into my started back in the substance back into my blood, and you started with the laser on the back, started the pain in my lower back. So where is the crash going on is going down after 2 minutes nearly to nothing, to 0.
In 2 minutes.
After you made the first time with the laser was 5 minutes. You remember you started with something. After 2 minutes, you remember when you said to me, I said, when you move so far with the back to the left, right? And then I told you, I want for my pain point, but I cannot go find it. I cannot go find the pain point. So and this is now to this moment. After 1 week, it's now to this moment. So it has not changed anything.
We're here with Stefan, day 3 post-procedure. He's looking, looking very bold and good today. So
You're gonna do this one.
The second is, I think this started around 90 minutes after when we finished our session here, is the pain in the shoulder is going really down. The pain in the shoulder is really down. And this is the first time more as after 5-6 years, I have so less pain up now with my shoulders. The second is, I think this started also was this the first time in the last week and the first night, not sure it's coming here, but it's so much in my pocket. But it's the first night I sleep after my accident completely the whole night.
great.
This is another case coming up. This guy's a Harvard research neuroscientist. Was diving at 200 feet, got an air embolus in his spinal artery, got pulled up, got CPR, survived, has had a fixed neurologic deficit for 35 years.
35.
And here's him.
Right,
Give it a date.
so the thing that most amazed me was that I had this long-term, like 35-year injury, and within hours I was seeing a change in the patient, and that's just not, we cannot accountable in the neurological model we have now. Like I had this sort of neurogenic numbness and my left body all the way down my whole left leg, which is, it's, I could touch, I could feel, but it was like just the same feeling no matter what you did, when you pinpricked it or pinched it or touched it or hot or cold, it all felt exactly the same. And I've accommodated to that. And so I've been after received the stem cells, but then a couple of hours later, I touched my, well, wait, that feels like a touch. And then I pinched my, that's a pinch, and it feels exactly like this pinch over here. So within 3 hours, this neurogenic numbness that had been there for 35 years just began to disappear.
I'll play this one.
Is that it?
I don't know. You want, there's
That was the first option.
one more if you want.
And then over the next few weeks, I
Was it the
began to
Parkinson's
notice
one?
a sense of touch returning to calm certain
Oh,
my hand.
we'll pause it for now.
So since my accident, I had absolutely
Oops.
no sensation.
Except I messed up.
And so.
I told you not to give me control of a computer.
So I
I
go
do
over
this.
and I get over to write, the pen is in my hand, the pen's still on the desk. But I couldn't tell because it felt like I had done the action, but I couldn't tell whether anything different. That I couldn't use that kid cups because I didn't crush them.
There's another, these are from Dr. Todd's his case studies, and that's Dr. Mercola who is presenting on some of them. Another one that they're going to do is another beautiful case of a Parkinson's patient that he had. who had remarkable results. The first was he could barely do a finger to nose. And after 3 treatments, he's dancing, literally dancing with his wife. I'm currently working with a Parkinson's patient myself, and so we'll see with him. My own story that, well, I haven't been doing as long as them to have so many clients, but the one that I still have a permagrin about is a close colleague of mine who I had to beg to come over and get treatments because this is so new, and they're like, anyways, got her over. And the reason I did is she's 53 and has end-stage heart failure. It was a complication of actually the modern medical model, but I won't go down that road. But needless to say, they gave her about, with anyone with heart failure, you never know if it's about 1.5 years or so. And she's got 3 kids in college, and she's the breadwinner of her family right now. And not that that mattered any, but her EF, if you know anything about ejection fraction, it's a sign of how much the heart is pumping. Okay. We never eject more than 60 to 80% of the blood volume with each beat. It's just, there always is a little residual to go in, right? So the best is between 60 and 80, no matter how young or old you're out there. Once you start getting, and don't quote me on the categories of congestive heart failure, but once you get down to 30, 25, 20, you're on end stage heart failure. And once you start getting down to 20 and lower, you're transplant for sure, if anything. And her echo was, I believe, it was like 25%, between 20 and 25%, which means her lungs would fill with fluid, her legs would get swollen. She had no exercise capacity, and she was an ER doctor and is now a teacher, and she's trying to run. Anyways, so I finally begged her to come in, and Dr. Todd's one of the studies that they have published. I think they have a cohort of about 10 patients, and they've had remarkable results with turning around heart failure. I can get into the details later if you want, but I don't want to bore you. But with one treatment, and I also did a couple other pieces of organs or organ systems that need a little extra support, but majority of the time was spent on her heart. I get this text. Now, I had to blow up her phone to get her to come on over. And here she is texting me. So I'm like, okay. And she goes, when's the next treatment? I'm like, crap, when do you want it? And I'm like, why? And then before I even could ask why, she sends me another text, and it's a picture or a report of another echo. I'm like, why'd she get another echo? It's been a month, and I'm looking at it, and she has some other motives to try to get prepared for surgery or other things like that, but she wasn't doing any other lifestyle changes to speak of. And I'm reading the report, and her echo now shows an EF of 45%.
Nice.
1 month. And I asked her, I'm like, why'd you get an echo so fast? And she wasn't going to, but her doctor, she was doing a appointment for this other follow-up, and he had noticed that she wasn't wheezing. Her legs didn't look so swollen. She was walking and talking fine. He goes, let's just get an echo. I'm not sure if he even knew that we did this Vsel treatment. I think she told him, I'm not sure. But even without being prompted, so she did do a second one, and we have another follow-up echo to do. But that's to be able to even give possibility for things that there weren't possibilities before. That's why I do what I do. So
This is extraordinary.
now do we have any questions? Did that spark any curiosity or
Is there an
anything?
accumulation effect?
Sorry,
When
what?
you're treating a certain area, would there be an accumulation effect?
Yeah. You mean over time? Mm-hmm. Mm-hmm. Which is why I'm never say never, right? I don't necessarily believe in a one and done for anything. And I also don't believe in things in isolation. If one isn't taking care of their body, recognizing how toxic they may be, taking care of the other components of their body, just getting stem cells, I'd love to take your money, but it's a waste of money, it's a waste of time. there's, which is why I don't practice that way. It's a journey. And along that journey, it is most effective depending, it really does depend on what we're treating though, or not treating, but what we're addressing, of how often or how frequent to get the best results. And everybody's different,
Are
but
they strictly using their own?
Mhm.
Okay.
I mean, I have used other products and there are indications. I mean, actually now it's like, why go elsewhere if you can get it from yourself? But there's no problem with getting it from other things, but I don't necessarily see a need to, but yeah,
Like the younger is better, analogy wouldn't be,
but yours are younger,
no, I'm just saying. in
but yours
general,
are younger.
Even if it was from umbilical cord, would it be?
Yours are younger. No, the thought is that they're the same.
Okay.
Yeah.
So
Sorry.
you know the theory.
But along with that theory, these stem cells are as young as umbilical cord.
Right.
That's
Because
why,
it's the
that's why I was
nucleus.
being like annoying.
It's the nucleus. Right.
Yeah. Yeah.
I have a question from someone who's watching on the Zoom call.
Mhm.
How long does the treatment session take?
Mhm.
And can you describe the process of the session?
Okay. I walked through part of the process before it had any context. The whole session, not including getting to know somebody, physical exams, consultation, and all that kind of stuff, but just the actual session itself, hour and a half, maybe. And that, like I said, is simply a blood draw. It takes 10 minutes to spin it down to PRP. Takes about 3 minutes to 6 minutes because there's 2 tubes to activate it, and another 30 minutes to infuse it. Granted, there's time in there where we're getting putting our attention to it and all that kind of stuff, but those are the components, and that's really the time frame.
So what volume do you collect exactly for the stem cell? What volume?
60 cc's.
Just 60.
Now we can do more if we were, because you can take these same stem cells, and pretty much all of those also can, most likely, because I know the people that do it, were also injected into other parts of your body, which are just as effective and actually more effective if you were doing joints, because joints don't have as much of a vasculature or vascular supply, sorry. And if we are relying on the blood to get to an area in order to bring the stem cells there, not to say that you don't get effects just by lasering a joint. The same woman that I told you had the heart failure, in the same text, she goes, "Oh, and that thing you did on my knee hasn't hurt since." And I didn't spend a lot of time on her knee, and I didn't inject her knee, but I still think you might get a little bit more bang for your buck if you also used your same VSELs, and if you were doing a joint or some other parts of your body, you can inject it, and therefore we draw more blood.
Another question. Does it require pre-medication to mobilize the?
It doesn't, however, it doesn't, because they're already there. However, I also like to optimize what we can get, and I use a couple products. Stem Regen is one, but I also recommend things that mobilize our own stem cells. We were talking earlier about cold activation. A couple of the devices here, the CVAC, some hyperbaric, we're talking about cold and cryo, things that naturally stimulate your body's activation of stem cells. Now, stem cells don't stay in circulation very long. So if you did, let's say, a hyperbaric 3 days ago, great. You're getting your body in tune and it's good, but it's not necessarily going to affect the volume of VSELs that I'm getting from your blood at that particular point in time. So they're optimizing the body before, but yes, there are other ways to activate it, but you don't need to stimulate it during the procedure per se.
And I have another
And then we're here. Then you're
person
next.
calling. They're asking, so can one treatment be directed to multiple areas of the body? So you're basically saying you're putting the blood back in, the laser is turning it on, and because he said he's done PRP with no success, and he's asking how this is different.
Yeah, it's important.
PRP and VSELs are very different. we are using a PRP fraction of your blood, and they have a couple of goodies, but the powerful part of this are the stem cells. And I guess the part that I didn't elaborate on is when we're doing the infusion, and I said we've got about 30 minutes. So during that time, depending on, because this is very individualized, there are some protocols kind of protocols, but it's still very individualized on what that individual is seeking. We do hit multiple spots. Now the difference is, it's not a difference per se, but like the Parkinson's, you want to, if there is one particular area that you really want to focus on, you spend the majority of your time there. And then you highlight, like for Parkinson's, the rest of the brain and some of the other supportive structures for repair, your thymus, your hypothyroids, your adrenals. If you're doing the longevity, they so far, again, this is new. One thing that we can say is we've shown that one treatment, the longevity protocol treatment, can decrease your biological age by 3 years. So just to not age, you do a couple treatments a year and you're good. Granted, you're also doing the other things to keep us nice and healthy, but it has been shown. And so in that protocol, you are hitting the organs of, I would say, life-sustaining. So brain, pineal, again, your thyroid, your thymus, hit the pituitary in there, adrenals, gonads. So yes, you can hit multiple at one time. It just depends on how much we want to focus on. And then 1 second, I think you've had your hand up for a while.
No worries. How many sessions do you usually recommend, let's say, and have you had success with osteoarthritis? And do you have to do boosters? How long will it last? How often would you have to do boosters?
Good question, because we don't have all the data on that because it's still new and everybody's different. If you're talking about those particular indications, I would say at least 3, but you got to give your body a few months, right? Actually get improved results over time. So if you don't see results in 3 weeks, you might in 6. If there are, let's say, a fixed lesion like that guy had for a stroke or trauma, you might want to hit it a few times. Maybe be really aggressive and do it once a month, once every 2 months. Some people would say once a month might be a little bit too aggressive, and I wouldn't necessarily say that, but it's a conversation. If you're talking about boosters or longevity, every quarter, if you want to really be on top of it, but even twice a year would give you a lot of, what's a good word before ahead of the game? Keep your vitality up. But yes, you need a couple treatments, and but do know with time, our cells are always going over. There's always wear and tear. So again, it's not a one and done. There are upkeep, but some people just need that one repair, and the area is repaired. It's no longer going to give them trouble, and then you don't need to. If it's not giving you trouble, like I say, don't fix it. But there's going to be other parts of your body you may need to address. So,
how about the advantages and disadvantages of this system with VSELs compared to totipotent cells?
Well, I would never use totipotent cells in the sense that they are just too high of a risk for mutagenesis, either the cancer or turning into a teratoma, which is a fancy word for structures that have all the different organ systems and more cancerous like.
I'm just wondering, have you checked or anyone checked to see if this possibly affects the why did I just lose the word? Telomeres, because if you're actually reversing aging in that respect, would it?
I know they've done that on other forms of stem cells, and I don't know if they've looked specifically at VSELs. My guess would be they are, because just because it's a different type doesn't mean the research and studies behind stem cells in general don't apply.
Right.
I think there's one for VSEL specific. There's not the linking of that we read.
I do think there are. I think there are.
Interesting.
I just wanted to share because all the questions
Oh, yeah.
being asked, I wanted to share my experience.
Please.
I did two experiments on myself. One was the full body stem cell makeover where I went to a clinic in Utah and they harvested my own stem cells and injected them in all the
All
parts in my body. I've hurt myself all over the years and had a lot of pain. it was painful. It took a whole day under complete anesthesia. It took 3 days to recover because they had to take the stem cells from the fat. So there was a mini lipo to extract the fat, take the stem cells. It was a tedious, painful process because I chose to do autologous stem cells. And then it worked. It worked. It was very, very successful. And I'm still benefiting from it. And then I met Sienna and we did, how long ago was that?
March, I think.
6 months,
6 months.
5, 6 months.
Yeah.
And we did a Vsel procedure. But it was a hybrid one where they injected some in my knee, in my neck, and in my ankle, which were places that hurt, and it did also the IV part with the laser activation and so on. And I have to tell you, there's no comparison. The Vsel process is sweet, soft. There is no issues with it. You don't have to go to sleep. It doesn't hurt. Of course, I chose injections in my neck because I have a collapsed disc in my neck. And every time I go to sleep at night, I wake up in the morning with massive headaches because the collapsed disc twists some nerves. And I tried this, and I'm here to tell you guys, I have never had a headache since I did this.
Wow.
It's been 5 months. One treatment.
That's incredible. Wow.
You do. Yes.
You mentioned laser activation and using frequency code to activate.
So this is a proprietary laser. And again, it's not laser in the sense of what we'd normally consider specific, but it is a specific frequency and wavelength that is dialed in. We have to recalibrate it each time. And Dr. Todd does a really good job of describing way beyond my physics, and I've still seen it. I've read it a million times. But it is a way that, based on the way the mirrors are aligned, it creates a counter wave that is just offset about by 40 degrees. So it's not in complete resonance that we're either augmenting 100% or canceling it out, but just offset. And based on their calculations and the frequency of VSELs, it's that specific node. Now, it's not one that would necessarily be used for all other forms of photobiomodulation or light therapy, but it is targeted for this.
Have you ever experimented with imprinting a frequency code of an actual stem cell, like a hematopoietic stem cell, into, you'd have to have a salt or a sugar molecule, I think, to attach to?
Yeah, we have not done those imprinting.
You don't know.
But to touch again on the laser thing, just because I think it's unique. And I have seen another example of the woman who had the macular degeneration. This laser, I'm going to use the word laser again for lack of a better word, is so gentle. You can actually take it and shine it directly into the eye, into the back of the retina, which is part of the protocol. And you can stare at it, which you can't even look at most lasers, right? Just wear glasses, it's damaging. This is actually healing. So it brings the stem cells back to the laser, the back of the eye, and the rest of the protocol also is taking those stem cells, and you're also drawing them back along the radiata of the optical course into the visual cortex, which is in the back of the occipital lobe. So it is that safe.
One last question, if you don't mind. So how do you get the stem cells to target an area? Because once it's in your bloodstream.
That was when I talked about how they are kind of imprinted.
Yeah.
Oh, you could, hey, if you learn, answer. Let me see.
At the beginning, it's like the sound. She explained about the blade with the agar and the.
Maybe they learned. That's good. That's good.
And where they put the laser, the cells go back to the laser, where the laser was before. So
It's like antibody reaction.
It is quantum entanglement in a sense. It is an imprinting, but yeah, it really is.
Just as a general idea, say if you had somebody like this person you're working with who has Parkinson, how long do you think that he or she would need to do this until the person felt quite well?
Until they feel quite well. It is much different. I understand, because they're like, how long do we do this until, if we're not necessarily getting effects, when do we know? It's, and it's tough when it's been around for a while, and particularly with this client, they're doing a lot of amazing modalities. So I don't even have to add in all the other stuff. They're doing the I did make them do the hyperbarics, but they're already doing the nutritional stuff. They're already doing the movement piece. They're already doing some of the mindfulness piece. Yeah, which is quite a pro. At least 3 treatments, I would say.
From the audience watching, is it effective for children? And so somebody asked.
Yes.
Okay, so it is effective for children. And then since it crosses the blood-brain barrier, what about the effects for any type of neurological degenerative, Alzheimer's?
100%.
Okay.
Again, not allowed to make claims. So if we go by theory and we go by what we've seen, you are bringing regenerative signals, and that's what stem cells are. They're signals to that part of the body with the nutrient information to do what that area is supposed to do. That basically you're waking it up. You're like delivering, and that's what we use different terms. I like the term now, information. And that's, and the stem cells are saying they're not actually going there and like creating a tumor themselves. They are going to the tissues that are already there. They're waking up your bodies, and not your body, but that organ's endogenous stem cell population. So they're adding to it, but they're turning something back on, and they are encouraging that behavior back on. So, right. And which is why for any regenerative process. So one thing that I was actually on a Zoom call this morning with a group of doctors that provide the VSELs, and one provider who's really getting this cohort on heart failure. And he's all excited. He's got a bunch of patients and he's treating a lot of them. And one of his clients came back and he goes, you know what? Everyone keeps commenting that my hair looks thicker and my skin is better. And they're just doing his heart. They're not targeting other parts. Now you can imagine maybe they're getting better blood flow, maybe might be some other things, but you regenerate one part of your body and you're improving all aspects of your body. And I would like to say we're not connected, but every part is connected. Yeah.
I would like to know about follow-up of these patients. Because, for example, for the macular degenerative disease, I know with time it's supposed to come back. If it's palliative or if it's like a...
Well, right. So one I would do, which is like why I like to know. But as I was mentioning a little earlier, our cells are always turning over. We're going through the natural process of life, which means we're constantly being exposed to, I'll use the word toxins for lack of a better word, but just the processes of living. And if somebody, yes, if over time they didn't do anything else, the macular degeneration is going to come back and continue. Yeah. Particularly if it's been so advanced. However, I don't know that if you stay on top of it, and the information again signals a new information to that part of the body. Right. They don't necessarily carry that same memory to go down that pathology anymore, because pathology is just misinformation. And that's why just because we diagnose with something, I hate that word because then people feel that that's what they're stuck with. They're always going to have that. And that's not the case. So I would imagine it may need some upkeep, but if somebody is also embodying that they are being, again, healed, bad word, they may not.
May I ask a question? So, okay. So you
I like that you asked.
About information, that this is actually bringing information, which makes me think of the works of Dr. Jonas Spenza, where he says, with information biology, that when there's no more information for the cell dies. Right. Hence, the idea for doing the meditation where you place this particular information.
Right.
And so that's just so fascinating that I wonder if it would be beneficial to combine the two.
Well, I think that they are related.
Yeah.
I think this would be maybe going on a limb here, so I don't know how much you guys want to talk about my beliefs on things, but stem cells and other parts of the body are the chemical enactment or the physical bodily enactment of what one, if you're talking about the biology of belief and the coherence and the consciousness of that form of healing, of believing that, it's that information and they're doing the work in one way. They work coherently together.
Yeah.
Does that make sense?
Yes.
When are you coming back? Like, when is like?
When are you starting work?
But when are you coming back?
Well, I'm here as long as you.
How did they get to you? Like, if do you do a lot of Q&As? Are they on Zoom? Like, how?
I'm always reachable. To some people's fault. Good question. I am going to be here. I'm going to have a
Oh, you're
location.
gonna be here.
Mhm.
Oh, excellent.
Yeah.
That's excellent. news.
Yep. And they're going to, I also will be available for consultations and all the other little fun things that I like to do. And that's diving into unique IVs, peptides, ozone.
Great. You need to
So
be
much other
doing
fun,
a
so much other fun
there.
stuff.
So,
Like I said,
available.
it's a package.
Good.
VSELs are one I'm most excited. Well, I say that about everything. I really do. They are one amazing thing just because I do feel they are so impactful. They are non-invasive, readily available. People need to know about them. And there's not a lot of practitioners out there yet doing it. So getting it out there and making it available is one piece to the puzzle. But yes, I'm here, I'm available, and
Good.
Yeah.
Will you be doing IBO zones or will you be taking the blood out and spinning it?
I do IV ozone. I have an EBU, which is the ozone dialysis. I also have just the high dose ozone you can do, just which is equivalent to a 3-pass, but I also have the ozone and it's with photobiomodulation as well.
The only real side effect is you cough really bad enough.
I haven't even found that.
No?
No, it depends on everyone's a little bit, depends on how sensitive one is or how much one, yeah. If one does start having symptoms or cough, that means that's where it's doing what it needed to do.
I don't know the right words I'm looking for, but what's the difference between going after one specific place or going after the multiple places in the body? Like, is it weakening the strength? Is it better to do separate and do this area at once and this area at once instead of doing all those things at once?
So this is where it's a discussion and we find what's the priority, right? Not what does one think their priority is, but what is the body's telling us our priority is. We may think that it's our, thumb, knee, or our vision, but in reality, we really got to get our parasympathetics, our nervous system relaxed. We need to get our heart function back up. We may need to optimize the body in a way that stem cells can help before we even tackle what we think one thinks is that main issue. So it's a conversation and it's an exam and we go through stuff. Easy way, well, not easy, but one simple answer is if we have a big priority like heart failure, and I spent a lot of time, but I also knew she's diabetic. Her knees were keeping her from being able to walk, to actually do the things that were going to help her lose the weight. She's high stress. So spent some time on the vagus nerve. You can literally do almost a stellate ganglion block just by lighting up the vagus nerve in the beginning, which I do for everybody to get some nice and calm, get the body to receive. Spent some time on the systems that are going to help her body repair, but most of the time on the heart, and then I target a few of the others. So it's case by case, but you're right. Since it's not a one and done, that's where a couple sessions come in to really help the body get to where it needs to be.
If I had embryonic stem cells, would it help to activate those? I had embryonic stem cells for arthritis in the hands. Would it affect it? Would it activate it, or just not even?
If they're still around, do you mean? Or
I had it in February, March.
IV or just injected in your? I don't know if they would turn them on, or if they're still around doing what they were going to do. So I'm not sure if it's not going to make it worse, but
it could still target that area.
Of course.
That's an area.
Of course. Anything else on anything? Beautiful latecomers.
it might have been asked already, but like, are you planning on doing a targeted injection of Vsels as well? Is it more whole body? Is it a combination?
It depends on what somebody wants. I really am a fan of the infusions, just because it is so non-invasive, not so non-invasive. It is non-invasive. Let me just add something while I'm thinking of it. Stephen brought up a point about the whole body stem cell, which is effective, but how I don't know if abrasive is the right word, but it's jarring, and it's kind of, to me it's more of a forced energy. And the beautiful thing about this, these is your body's own, this is your own life force. All we're doing is we're giving them a little push and then helping them go where we want them to go. But the energy is incongruent with who you are. It's healing, it's soft, it's welcoming. And when the body sees that, it naturally works with it and repairs. If something's forced, your body wants to protect itself. It shuts down. Your stress levels go up. Your pretty much everything shuts down. It's not an ideal environment for healing. And that's another reason why I really like the infusion. It's just, it's gentle. Now, we also, like we were saying earlier, we also can take the same stem cells and inject them into joints, celiac block, great for facials. That's not so painful, by the way. It's fantastic. It takes the vampire facial and like knocks it out of the park. And not that painful either. So yeah, we do both.
So a follow-up question, first of all, yeah, I love that answer. And a follow-up question to that would be, right now with stem cell therapy in general being so scarce, we see people, doing it like one and done, something that people are doing, hoping it will help, and kind of following how that goes. Do you have an opinion about multiple courses of treatment that are now available because of these cells and you being here? Maybe some data or just your opinion
on doing more than one?
On doing more than one, or even doing like theories or yeah.
It used to be it was something I don't want to say the word concerned, but I would make an opinion about it. When people would spend a lot of money and they would fly overseas because you couldn't get it here. And we went in, it was almost vacation. So people were vacationing, as far as what you do on vacation. It's not so much great sleep. It's not so much, healthy diets. And they go in and they get their injections, they get their stem cells, and they do the rest of the vacation for the day and they leave. And for some joints, it works well because you've got a localized area, it's targeted, local and target, same thing. And some people got some good results. And a lot of people are like, nah, didn't get much. One is because it was just a one and done. And two, it was because it wasn't being sandwiched or cared for with other modalities to do something with those stem cells. To me, it's like if you gave, I was trying to think of a good analogy the other day. If you gave an artist a bunch of paint and you sat them down and then you just like tied their hands behind their back. They have the resources right there, but they're not giving the signal to actually start doing anything of paint. So if I give you stem cells, particularly let's say for a brain indication, and then I tell you to go sit and stare at the wall all day, there's no signal for your brain to start repair to do anything. Activate those areas. You now have the information to turn a tissue that may need that assistance, whether it's been turned off for too long or it's overinflamed. And that's where the healing happens. So that it does need that container. And where, again, another treatment may be necessary. Now that they've been doing now they're turned back on, they're doing some stuff, another one kind of just takes it up a notch, which is why on these examples, it took 3 treatments for the person to start riding a bike. It took at least 3 treatments for them to start feeling again and moving some things again. So yeah.
Yeah. So what other modalities May I have one? question?
Yeah, he has one after this. Go ahead. Go ahead.
So just what other modalities do you see being synergetic with these cells as far as things that we have here or?
How much time do you have?
Yeah, right.
No, seriously. So any form of cleansing of the body and a detox. I mean, if your body's toxic, which you mostly all are, it can't get ignored. I wish it could, but the body, if it's constantly inflamed, and I know that's a little difficult definition. I used to be like, well, what the heck does that even mean? And that's a whole nother talk, but at least addressing that in the beginning. And then it just, I mean, pick one. There's the photobiomodulators, the infrared beds, hyperbarics, CVAC, cryo, anything to get our nervous system down on a regular basis. And there's a lot of fun modalities for that. There are some nutraceuticals, and there are some great peptides, and there's some other things that help augment what they're doing as well. What other ones am I missing out there? Ozone, methylene blue. It depends on the indication on which ones I would stack with what, but just go by the rooms. There's, yeah. And then there's a timing. It's not like you walk into a lot of these places and it's just like, okay, which one should I do today? There's a timing for when to do these things as best for each individual. And that, again, another whole conversation. But to optimize this, it takes some guidance. So, probably vague.
That was a great answer.
So you mentioned, and we saw in the video, spinal cord. What about other spinal tissue, disc tissue? You said if it's an area that's not vascular, obviously that would be more of a localized treatment for something like a disc. Have you seen any?
Personally, I haven't, but I have still, even though I told you that it's not that vascular, the tissues around, we're talking particular discs, which don't have much of a vascular supply. And even when you do stem cells, there's a little bit out of my experience, but from all of the conferences and from the specialists that I've spoken to, it even depends on what type of stem cell, because they're talking about PRP versus other, of which factors are going to go there to actually do the repair, right? And it depends if it has a vascular supply and a few other things. So people with some disc disease have still seen improvement because it's usually not just an isolated disc. It's all of the structural tissues also around the spine that are causing the disc problem. And you address those, and sometimes naturally the disc problem gets better. And so again, these are bringing healing information to the area that is trying to compensate for something that's out of whack. And so even though you're not necessarily, maybe not necessarily, it might be going straight to the disc, you get improved symptoms just by even addressing the what's a better word? The misinformation, the malalignment that's in that area already.
So you need a case study is what you're saying.
Do you know somebody?
All right.
Be happy to. Yeah.
Don't most major organs of the body produce their own stem cells? And is it true that starting about middle age, they congregate around the femur bone? And would this help release those so they're back in circulation?
Stem cells do come from your bone marrow. There are some, we do know that there are stem cells from each organ. The majority are coming from your bone marrow, and they go to those tissues and they increase the signal. And yes, over time, the type of bone marrow changes. And so the amount of the capacity of our body to produce these stem cells go down. They usually just because the bone marrow is being replaced with a different type of bone marrow. So there are a lot of other products here. There's things out there and things that we can do to decrease that conversion. And yes, this does help. Yeah, it helps keep stem cells in circulation and do the repair, even if our natural, which they do with time, but they don't have to. It is a consequence of aging, which we think, oh, it just naturally happens because all of our graphs show that they go down with age. It does, but it doesn't have to. Exactly. But yes, it will help in that.
Could it be because your enzyme bank is depleted from eating so much cooked food?
There's a lot of reasons. That's probably one of them. It's a lot of it is metabolic dysfunction in the sense of metabolic and energetic or bioenergetic reserves. and quite a few other little things, but yes, that's definitely a component.
I think we have about 10 more minutes left, so. If anybody's asking more
Whatever,
questions.
whatever.
I think there's that other case that.
Yeah, that the Parkinson's, but I think he did a good job and. Very good job.
Yeah, thank you so
Very,
much.
very informative.
I mean, you can talk about anything. It doesn't have to just be VSELs. Yeah.
So I have another question, probably it's a little bit more of a nuanced question, but we do see, so you touched on this mold that needs to be applied to regenerative treatment, stem cell treatment in order to get maximum results. What we're seeing, what science shows as far as like things that discourage these type of molds within longevity strategies, such as, for example, metformin side berberine or cryo, which lower inflammation, hence we do not get that signal for repair. Is there any information alongside that and stem cells? Do we want to avoid things that diminish, inflammation in the body? Because it would compete with that stimulation for repair, like medications that are also conducive to longevity, or I can
Clarify a little bit. Yeah, clarify a little bit. You mean just around the time of like the
Mhm,
procedure?
Yeah.
Okay,
Yeah,
and
so-
then
So my question was, obviously we know if we want to get maximal results from, for example, weightlifting. Okay, that's just an easier example. We know that modalities which lower inflammation might blunt the effects of hypertrophy, basically, because we're impeding the signal for
growth,
repair and growth. When we're getting into a non-anabolic phase. But the same thing can happen when we're trying to create repair if we're lowering that signal for repair, which is inflammatory in nature. Do you know if we want to kind of stop a little bit with, like, if we take metformin or rapamycin, for example, or we do cryo every day? Is it something that we want to stop around the time where we provide those stem cells?
Sure. Yeah. My personal quick answer to that, whether it's because these are, everyone's gonna have a little bit of a different opinion and it's gonna be a little bit different. My thought on that is stem cells only stay in circulation about 6 hours, right? So decreasing competitive signals before you are going to bring out these stem cells to go to an area repair would be good. So keeping your body as least inflamed before would be good, because then it makes it more clear, even though we're using the laser to go there, where do we want to go for repair? And then, as I was saying, utilize that area. Now we tell people, and this is where I was been rethinking a couple of stuff, but they go hand in hand. Jumping on a plane the day after a procedure, you're exposing yourselves to EMFs and radiation and other people maybe being cold. Basically, you're putting your body under stress to go deal with other stuff, right? Where you want it to stay where it was and not be overstressed and doing extra work. That's true. However, just like I was talking about the person who, if they have a brain issue, we want them to not be staring at a wall, or somebody who just do something with their knee, we want them to slowly use that area. We want to say, hey, okay, this is what it means like to repair. This is the motions we want you to do. If you're in the brain, we want you to do those puzzles. We want you to do the balance things. We want you, right? But not to confuse the signal with inflammation again, or other stressors that the body is just overwhelmed with already. Is that, so as far as taking things that are, I actually agree with taking like a round of senolytics before and other anti-inflammatory, clear out that part of the body, give it the nutrients it needs, whether it's methylene blue, it's some NAD and some B vitamins and C, give it the nutrients it needs. That once it has this information, it has its team to do the work that is being asked to do.
Yeah.
Does that make sense?
Would it be better to avoid a treatment if your immune system is lowered because you're ill or something, you have a virus or something?
Yeah, I would not, yeah, I would not do it if you're acutely ill.
Okay.
It did, I mean, you could do,
Chronic illness
you,
is-
you
is-
could, it's just a
yeah.
waste of money. Unless, I mean, granted, it will maybe help you get better faster, but it'd be one really expensive way to get over a virus.
And your body's gonna be trying to get over the virus as opposed to.
Well, I mean, we could take that and
Yeah.
take it to your lungs or take
Yeah.
it to your sinuses and your thymus, which we'll probably just stick it right here on your thymus, which is your main immune modulator in your body anyways, spleen a little bit. But no, I would not do it if you are acutely ill, for sure.
Any results with long COVID?
Personally, I have not had, but I have seen long COVID in the sense that, well, actually it could be any of them. I think it's a great one for long COVID, particularly if you've got brain fog or brain issues, you know, highlighting your thymus, which is being your heart, those organs that may be affected. Now the pathophys is a little bit different, but if you are building your body's ability to handle a dysregulation, I can't help it. I mean, it's going to help with pretty much anything. Even autoimmune, and that's how it helps with autoimmune, because autoimmune is a dysregulation. You're basically trying to get that information, those signals kind of back in alignment. Because, I mean, how do you target an autoimmune, or how do you target some of the things? It's not one organ. But if you highlight the organs that are involved in the processes of getting of your body functioning, then of course.
I have a question. How soon will you be back? And how can we book you?
What are you doing tomorrow?
Are you really doing it?
Not tomorrow, but next week, week after, as soon as we can. Yeah, for sure. Yeah.
So are there preliminary tests that need to be done to determine what needs to be targeted? Like I can come in and tell you I'm in pain here and I'm suffering here. Are there tests that you do to qualify that?
I don't believe that you got pain there. No. There, do I, besides an exam, it would depend on what we're trying to target. I mean, of course, it's very, very safe. There are only a couple contraindications, and it's because of the process of drawing the blood of PRP is if your platelets are in the toilet, you're not going to get necessarily the best product, right? If you have active cancer, it's a conversation.
Right.
We don't do it per se, but there are people out there, and it's a conversation, right? But apart from that, and being acutely ill, there really aren't contraindications. There's discussions. So I don't need blood work. It is useful for certain things as far as markers, if we are looking for certain types of markers or how one's metabolically may be doing, but I don't need labs.
Would it help offset the side effects of vaccines, meaning the spike proteins that are created in the plots?
Hopefully.
I would think it would.
Ideally.
How long between the collection and the reinfusion?
Needs to be reinfused within 4 hours. It's usually reinfused within 2 minutes.
2 minutes. How much? 2 minutes? 2 minutes?
It can be. I mean, as soon as it's done being activated, and I always
have to centrifuge it?
You centrifuge it for 10 minutes. Then the whole activation takes about 6 minutes. Then you put your intention. So as long as you want to hold your babies and give your intention, and then we infuse it.
I love that you do that.
Yeah. There's certain sound frequencies that are involved with all of this. It's yeah,
Have
it's
you
pretty cool.
seen or heard of any success with like benign prostate hyperplasia or prostate stuff? Since like with macular degeneration, it's like something degenerative, and prostate something that as you age is
I'm sure.
Return the clock back on that.
I'm sure. I not personally, I've not seen,
Okay.
but I can't see why it wouldn't.
The methodology, it should be the same as with anything else. Okay.
Go ahead. Go.
Thank you so much.
No problem. Take care.
I'm on grandma duty.
Yep, no problem. Thank you for coming.
I also think it's 6 o'clock now. Anyway,
Okay.
so.
Well, thank you for listening to me longer than. Are we off? Okay. Now I can talk. No.